Anneliese Dressel, who joins me from the Health Hub Times Square in Ballincollig. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And you're very welcome, and a lot of questions in for you. Let me start with this one. Could Anneliese recommend a cream for our lad? He's 15, suffers badly with dry skin, mostly on his arms, legs and hands. He is using a product called Skin Food, but it's quite expensive, and I'm wondering, is there a cheaper alternative that might actually work better?
Yeah, so when I hear dry skin, Patricia, on a regular basis, I mean, most people will get a bit drier skin in the wintertime because you're indoors and the heating, and that will dry out your skin. But if you've got dry skin on a very long-term basis, and especially if you've got little kind of chicken skin pimples on your arms, that could be an indicator that you're lacking the oils on the inside. And a lot of people who get eczema, part of the problem is that their skin is so dry, it doesn't hold on to oils, and that's why it's so easy for it to become itchy and damaged. But in this case with the dry skin, I definitely would suggest either getting the oils into the diet. The best one are the omega-3 oils for skin and the omega-7. So if you were to eat lots of, like, put seeds on your breakfast cereal in the morning, particularly chia seeds, pumpkin seeds, linseeds, they would be full of those oils. Walnuts are a great source of omega-3, and of course our oily fish, herring, salmon, mackerel, all of those are great. I'm a great believer in a tablespoon of olive oil every day. I think it's just, if you get a good quality organic cold pressed olive oil, it's as good as medicine to take a tablespoon of that every day. And you could use it, drizzle it over your dinner, or you can use it as a salad dressing or put it into soups or smoothies, whatever way you want to take it. And then in terms of creams, there's a couple of creams that work very well. And again, you see, they do tend to be expensive, unfortunately. But the one that seems to work the best for a lot of our customers is called Hope's Relief. And there's two kinds. There's one for very severe eczema breakouts, and that one is a bit more pricey. But there's a bigger size one for the body. That's fantastic for dry skin. It's about €14, but it is at least 3 times the size of the Skin Food, I think, that lady was talking about. So the Hope's Relief Eczema Cream is fantastic. I would recommend that. And then this is another one that's not necessarily health shop related, but you could get it in a pharmacy, and it contains something called urea, and that can be fantastic for dry skin as well, especially kind of hard dry skin around elbows and for your feet. So somewhere like Boots would have that.
Okay, a question for Anneliese. Why does my daughter keep getting reoccurring styes? Could she be lacking in something? That's Margaret in Douglas.
Yes. Now, I suppose, I think you're kind of prone to styes, Patricia. So I think when you'd be run down, or if your immune system was battling something else, that's when you'd get them. It's like some people are more prone to mouth ulcers, and some people are prone to getting cold sores. And you'll notice they'll always appear if you're starting to feel tired, or if you've been burning the candles at both ends. So that's obviously her weakness in the eye. I don't think it's so much a deficiency of anything. I think it's just probably when her own system is under pressure. So depending if her diet is good. If her diet's not great, I mean, a multivitamin would be good to cover all of the bases. And you don't have to have a fantastic one. You can just get a fairly reasonably priced one. I'm a big fan myself of the Terra Nova multivitamins because they're all food-based. So all of the nutrients that are in those capsules have actually originally come from a food. So that's what I love about them. They do one called Living Multi, and that would be a great one for this young girl, because there'd be a lot of stuff in there for skin as well. So that would be a good thing to start. Definitely vitamin D deficiency, particularly this time of the year. If you're not going to take a multi, take a vitamin D. And you might want to take something to support the immune system. So you could look at things like echinacea, or I'm a big fan myself of the beta-glucans that come from mushrooms. They're fantastic antivirals, but they really do keep the immune system boosted. And I think that's probably the best approach. And then another thing I'd suggest is just, even when the eye doesn't have a stye, I'd actually recommend cleaning it at night time, maybe just with a cotton pad, some warm water and a bit of salt, just to keep it clean, to make sure that, you know, the pores aren't clogged there.
Is it an old wives' tale to use a cold tea bag?
No, definitely not, in the sense that caffeine is wonderful actually for kind of puffy eyes, Patricia. There's a caffeine element of it. But also chamomile tea bags are very, very good for sore and itchy eyes. So I think just make sure you soak it in very hot water, let it cool down, and then as wet as you can manage it, put the bag on your eye.
Okay.
And very, very soothing.
Okay. Hi, Anneliese. I recently had my gallbladder removed. Would you recommend me taking a digestive enzyme? My doctor seems to think I don't need one. I'm confused.
Well, I suppose you're the person who'd be the best judge of that. So if you still feel a bit sticky or nauseous, or if you still get pain or a runny tummy after eating fatty foods like, say, lamb or a dessert with cream or anything that's fatty, sausages, if you feel unwell after eating those, you could definitely benefit from a digestive enzyme. If you feel absolutely grand, you probably don't need it. And a lot of doctors do actually, they do prescribe a kind of a bile sort of a enzyme, Patricia. I've seen people come in with those prescriptions after having their gallbladders removed. So not all doctors would say that you don't need to take anything. I think judge it yourself. If you do take a digestive enzyme after your gallbladder's gone, try and get something with ox bile in it. I know the one that we have here, I think the Solgar digestive enzyme used to have some ox bile in it. And also then we don't have that one, but we have the Nature's Plus, and it's called Ultrazyme, and we get great feedback on that. And there's also a BioCare do an artichoke and lipase complex. And that's a great one if you know you're going to have a fatty meal, because it just contains extra of the fat digesting enzyme.
Does ox bile come from where I think it comes from?
Yes.
Okay, we'll move
Absolutely.
on.
Actually, another way to kind of stimulate your own bile, though, as well, Patricia, is it's made from phospholipids. So taking lecithin on your breakfast in the morning, which is very easy. It's great for helping get rid of cholesterol out of the body as well. And then before you eat something, take bitters. So I would often have a bottle of yarrow at home. It's the extract from the yarrow plant, and it's very, very bitter. Gentian is another one. Swedish bitters. People used to get kind of a digestif before they'd eat a heavy meal, and it would have all of those bitter herbs in there, and that stimulates the bile flow from the liver. And that would be, if you don't want to take a digestive enzyme, that would be a great way to support your digestion.
Okay, hi Anneliese. I'm currently taking Revive Meno Active and Revive Joint Complex every day. I'm still feeling extremely hot every day. How many sage drops can I take morning and night to stop these bloody hot flushes?
So that really is down to the person, Patricia, because some people just need to take a little bit and some people will need to take more. So I think, so she's saying she's taking the Menoactive. I think there is some sage in that. You could top up just by buying sage tea. That would be a very easy way of doing it, and you could have 3 cups of sage tea a day. Otherwise, I would start off, if you've got the drops, I would start off by what it says on the pack, which I think is probably 15 drops. And then if that's not doing the job, increase it to twice a day, and then maybe up to 3 times a day. And then if the sweats are occurring more at night time, just if you're going to take it just once a day, take it closer to the night time, or take a cup of sage tea before you go to bed. Because even if you're on all of the menopause stuff, Patricia, we're still getting fluctuations of hormones. So there will be times where you'll feel great, and then it'll be like you've gone backwards again for a while. So hopefully it'll just take a month or 2 of evening out, and you'll be back to normal again.
Okay, advice please, Anneliese, for black circles with puffy eyes. I'm in my 60s. It actually makes me look older, and I'm wrecked no matter what concealer I use. I'm on a good multivitamin and I take a daily fish oil. Any suggestions for black circles and puffy eyes?
Yeah, it's a difficult one, Patricia, because it is very genetic. Sometimes the black circles could indicate an iron deficiency, so that would be always the first question I'd ask. Has this person been low in iron in the past? And maybe if so, take something like iron, but make sure you get B12 and folate with it, because they all work together. If you've taken an iron supplement before and it's not actually taking, so if it's not bringing your levels of iron up, Patricia, B6 is very important for the absorption of iron, and that can be the missing link for some people. So we have a very good supplement here called Hemaplex, and it's got all of those things in there if you want to kind of make sure you're getting everything for healthy blood flow. In terms of puffy eyes, again, that tends to be very genetic, but things can contribute to it, like, you know, a very high-fat, high-salt, high-sugar diet would make a big difference. It's all about the flow. Is the the liquid from your cells leaks out, and it's your lymph who's responsible for collecting up that excess liquid between tissues and returning it back into the bloodstream for circulation. So supporting your lymph is very important, and the herbs that do that are dandelion, burdock, artichoke, all of those kind of bittery ones. you could try something like that. And back to the tea bags again, like we spoke about earlier, they're great for bringing down puffiness.
Okay, this is from Anna. Morning, Anneliese. Could I ask you please about sciatica or disc dysfunction, and are they related? Severe pain is gone, but I still have pain along my lower back. It was my first time ever getting it. It was terrible. Anything for it or to prevent it coming back? I'm an athlete, I am having physio and I am doing my stretches at the moment.
Yeah, so do you know what now? Sciatica is a trapped nerve, Patricia, and so that wouldn't be my area of expertise, really. Being a nutritionist, it would be more speaking to, I suppose, a chiropractor or an osteopath or a physical therapist about prevention, because it's a physical problem. So your nerve becomes trapped and therefore inflamed, or becomes inflamed and therefore entrapped. If your disc is struggling, and if there's wear and tear between your discs, that definitely would put a little bit more pressure on the sciatica. And this just purely from from people reporting back to me sometimes, the best solution is an injection into the piriformis muscle of the buttock, and that seems to block the pain that the trapped nerve causes going down into the legs and into the back. So that could be a good treatment. The other thing then would be to support your discs to keep them as healthy as possible. So this person said they're an athlete. I really think running is very, very difficult on the body. So you definitely need to support all of the joints. All of that impact will affect your joint in terms of wear and tear. So the ones we normally recommend for that, there's two that work fantastically actually. One of them is the GAL-UC2 cartilage, and for some people that's the magic answer. And then the other one, which I think might be more suitable here for this person, is the One Nutrition joint support, and we get excellent feedback on that for wear and tear arthritis. So even if you've no aches and pains anywhere else, if you're an athlete and if you've disc problems, you should definitely start on that as a preventative measure.
Okay, hi Anneliese. I've taken Nutri-Advance berberine twice and I've been terribly sick. I thought the first time it was just a stomach bug, but then I took it a week later and the same thing happened. Advice, please.
Yeah, well, I would just say it doesn't suit that person. So berberine comes from the berberis tree. It is quite a bitter herb, and it may be just that your digestive system is not up to coping with it. Sometimes I think it's always, it might be better to take something after a main meal or after food if you do have a sensitive stomach. And if you try that and it doesn't work, then it isn't suitable for you. And that does happen. It's very unusual, and that's the first time I've heard berberine upset somebody. But I'm not surprised, because it is quite a bitter, strong herb. So if it doesn't suit you, unfortunately, your only option would be maybe to try a lower dose one, if you could get the pill in a lower dose, if you really do feel you want to continue taking it.
Okay, and Dan is in his 70s and he said in recent times he started suffering from pain just in his upper arms. Is there anything you could suggest that might help remedy it?
Yeah, I'm not sure what that pain could be from. So, is it a muscular pain? Is it a more of an ache? Is it a stabbing pain? Is it coming from the joints? So if it's wear and tear of joints, we're back to looking at joint support. So people often get confused between bone and joint support, and actually they're very different, because the bones are calcium laid down on a collagen matrix that's very hard. And then joints are made up more of cartilage, which is a much more flexible material. So you need to support both, I suppose, as you get older, but it's particularly the cartilage that gets worn away with wear and tear. In this case, it's possible there's a problem with the neck if it's kind of referring down to both arms at the same time. So if it's the joint support, as we said earlier, either the One Nutrition joint support or the GAL-UC2 cartilage. If it's muscular, if you think it's a muscular problem, magnesium oil either rubbed in, or you can take magnesium to ease out aches and pains in the muscle. And if neither of those do it, it possibly is a problem coming from the neck. You might need a bit of physio.
Okay, and one final one from Rose in Clashmore. Any solution, please, to clear laryngitis? I have a nuisance of a cough with phlegm that I can't seem to clear from my throat, and I think because of that I'm getting repeated laryngitis.
Okay, so when I hear this now, I think it's not actually coming from the chest at all. I think it's possibly coming from the stomach. It's actually very common, Patricia, that people have a kind of a recurrent cough and bring up mucus. But what's happening actually is the little valve at the top of the stomach is weakened, so you're getting fumes and acid coming up, and you may not feel the burning sensation, but the fumes are causing you to catch your breath. So people would notice it's much worse at night when they lie down, or if they're having long conversations, they might find that it's worse after chatting. And that could be the stomach. It could be the stomach causing the problem, and that acid could affect the larynx as well, and would contribute to laryngitis. So if it is coming from the stomach, what we recommend is slippery elm to help line the stomach and the esophagus and soothe and heal it. And then we recommend zinc carnosine, which is a tablet that can help with the mucus-producing cells, but also it can help strengthen and tonify the muscle that keeps your stomach shut at the top. So we would recommend the two of those. If it is coming from the chest and laryngitis, things like marshmallow, mullein, carrageen, they're all really, really soothing for a kind of a dry and tickly cough. And there's a couple of bottles that I'd recommend. So my own personal favourite is the Comvita Manuka Honey Elixir. I think it is like magic. I love it. It's the one I go to whenever I've got a cough. But there's also the Bronchosan, which is by Vogel. That might be more easy to find, and that's specifically for tickly coughs. And Pure Essentials do a cough relief one, which is very good if you've got a lot of tickling, because there's a lot of mullein and marshmallow and propolis and things in there for soothing the throat and soothing the larynx as well.
Okay, and you'll put up all the information on your website, healthhubstore.com, later on this afternoon. Thanks, Anneliese. Have a lovely week. And we'll talk next Monday. Anneliese Dressel, Health Hub, Times Square in Ballincollig.